This job kind of chose me. It's more of a vocation for me. When I was a young kid, I had bone cancer, and so I had quite a few different orthopedic surgeries. And from that stemmed my interest in pursuing this field, and then narrowing it down to mostly hip and knee conditions. I try and get a picture of what someone's day-to-day life is like, how they're limited by their current ailment or condition, and what steps we can take to achieve the goals that they've set forward. And that might be as simple as some basic exercises, to medications, to possibly injections. If those conservative things aren't working, then we really can start discussing as a team together some surgical interventions, whether that's knee replacement, hip replacement, or some kind of revision type surgery if they've already had a hip or knee replacement. I think the benefit of coming to a place like McNeil specifically is that it's a community hospital, and what you get in that type of a community is more of a home family feel, because we're a smaller operation working, of course, for a bigger vocation, that being Loyola. But we tend to really attract people who are interested in staying in their own community. I'm a patient first type of physician. How can we make your day-to-day life better? What are your goals? What can I do specifically to help you achieve those goals? I'm so satisfied seeing people who I've either treated non-operatively or with surgery return to doing the things that they love. That gives me a lot of satisfaction.